Baseball has always been a part of Terry Francona's life. As the manager of the Boston Red Sox, he has led his team to 2 World Series titles and numerous other victories. As an athlete, however, he was no stranger to medical care, including surgery.
You know, I've had so many knee surgeries, I thought, you know, like an oil change. I go in, come out, and I actually did. I went in for what I thought was a routine knee arthroscopy about 6 years ago. And I found out the hard way, it's not always routine.
About a week after his operation, Terry's knees became sore, and he knew something was wrong.
I knew I was in trouble. Went down to the emergency room, was diagnosed with staph in both knees. Didn't realize what that meant. I had no idea. I never asked any questions. I just did what I was told.
Staph, or methicillin-resistant Staphylococcus aureus, or MRSA, is a dangerous drug-resistant bacterial infection. According to the Mayo Clinic, most lethal staph infections occur while patients are in the hospital. One of the reasons surgery patients can be so susceptible to infection is that the skin, which serves as the body's protective barrier, is cut, creating an incision that can serve as an entry point for germs. This incision is then closed with stitches, staples, or a bioadhesive. The body then goes to work, sealing off the incision. But the bacteria that entered the body prior to the start of the healing process can promote the beginnings of an infection.
Individuals who are engaged in athletic activity, there's lots of skin-to-skin contact, there are lots of opportunities for breakage in the skin.
When they get a break in the skin, the Staph aureus can get into the subcutaneous tissues under the skin and start an infection. Most community-acquired Staph aureus infections are of the skin.
As suspected, Terry's infection began in his knees as a result of his operation. Doctors knew they had to act fast to stop the infection from getting worse.
It got to a point where I don't know that the medical people thought they could stop the spiral, the downward spiral. I was kind of at its mercy, and it was difficult.
Patients should keep a watchful eye to make sure their wounds are as free from bacteria as possible. In fact, staph and other hospital-acquired infections can be spread through simple human contact. The washing or sanitizing of hands and keeping wounds properly covered can significantly reduce the risk of infection.
If you see your physician or your nurse or your nursing assistant come into the room and walk past the sink before they come over and touch you, I would suggest very strongly that you remind them that hand washing is very important for patient safety and for prevention of infection.
I don't think it's disrespectful to expect a professional person that's going to work on your body to be sanitized when they work on your body. There are germs floating around everywhere. That if they're going to touch my body and there's a wound or they're changing a dressing, don't want germ spread. That's just common sense. I would have never thought to have asked that before.
I called down there about the 8th.
Looking back, Terry wishes he had been a little more involved with his surgical procedures.
I wish I would have asked questions. I don't think it's disrespectful to ask a medical person or a doctor a question that you don't know. Doesn't mean you're questioning their ability. I just think we have a right to know when something's going on in our body, and most of us don't.
Now that he knows more about the dangerous infections that can occur in hospitals and in the community as well, Terry Francona understands how fortunate he is that his medical team took quick action that may have even saved his life.
I think as an athlete, most of your life you feel almost like you're bulletproof, and I was no different. And then this hit me, and I couldn't stop it, and I was scared, and it grabbed me and took hold of me, and that was troubling. I'm very fortunate to do what I'm doing now after what I went through then.